Are you grinding your teeth without even realizing it? Hi everyone, I'm Dr. F, and welcome to Teeth to Smile. If you find this content valuable, please subscribe to the channel and hit the like button. Your support helps us grow and bring you more science-backed, engaging videos. Thank you. What is bruxism? Bruxism is a condition where you unconsciously grind or clench your teeth. This can lead to jaw pain, headaches, tooth damage, and issues with your temporomandibular joint, TMJ. If left untreated, bruxism can cause tooth enamel erosion, increasing sensitivity, and the risk of severe dental problems. How to stop bruxism? During the day, you may be able to catch yourself clenching your teeth, similar to correcting bad posture. However, the real challenge is sleep bruxism, which happens while you are asleep. Sleep bruxism. Symptoms and warning signs. Sleep bruxism is classified as a sleep-related movement disorder and is often linked to sleep apnea. If you notice any of the following symptoms, it's time to consult your dentist: jaw pain or stiffness upon waking, increased tooth sensitivity, frequent headaches, neck pain or earache-like discomfort, signs of cheek biting inside the mouth. 9. Important. Many people with bruxism experience no obvious symptoms, making regular dental checkups crucial for early detection. Complications of bruxism. If left untreated, bruxism can cause tooth damage, including cracks, chips, and the need for fillings or crowns, chronic headaches, and jaw pain, TMJ disorders, which can lead to clicking, popping, or restricted jaw movement. What causes bruxism? The exact cause of bruxism is not fully understood, but it is often linked to stress and anxiety, the most common triggers. Emotional factors, such as frustration or tension. Genetics. Bruxism often runs in families. Medical conditions, including sleep apnea, Parkinson's disease, ADHD, and GERD. Sleep apnea is a significant risk factor. Many cases are first detected by dentists, so if your specialist suspects this condition, consider getting a sleep study. How to treat bruxism? The best treatment depends on the underlying cause. If stress is the trigger, stress management techniques and improved sleep hygiene may help. Protect your teeth. A night guard is an effective solution to prevent damage and reduce muscle tension. If you're wondering how to choose the best mouthguard for bruxism, consult your dentist for professional advice. If you clench your teeth during the day, make an effort to notice and stop the habit. If you suffer from sleep bruxism, identify the cause and protect your teeth with a night guard. If you experience jaw pain, headaches, or other symptoms, visit your dentist. If you work on a computer and tend to clench your jaw, consider wearing your mouthguard during the day. Well, at this point, we've reached the end of the video. We hope this information was helpful. If you enjoyed it, please give it a like and subscribe to the channel so you don't miss out on future videos. If you have any questions or doubts, feel free to write to us in the comments. We'll be happy to respond.